We need arts and culture to stay healthy. More than a pastime or luxury, engaging in arts and cultural activity benefits our health and well-being. Studies show a clear link between actively engaging in arts activities such as dancing, visiting museums, galleries, or theaters, and preventing or reducing the severity of mental health conditions. The global COVID-19 pandemic and the lockdowns led to the closure of public spaces, galleries, museums, art venues, and restrictions on social contact. How did this affect the mental health of those who could no longer access arts and cultural activities? The University of Liverpool has been researching this question, exploring the challenges and successes of alternative modes of provision in Liverpool City Region. We collected data on experiences of arts and culture organizations and their audiences during full lockdown, when restrictions were first lifted, and after full restrictions were eased. Liverpool is the perfect place to study these issues. It has the largest clustering of museums and galleries outside London. Cultural capital contributes 10% to the city region's economy. The city also has a pioneering history of harnessing arts for mental health care through partnerships between culture and health providers. Following interviews with representatives from 15 arts and culture organizations in the Liverpool City Region and online questionnaires with arts audiences and beneficiaries, we found that arts and culture organizations in Liverpool City Region responded rapidly and creatively to the pandemic, offering online programs as a lifeline for vulnerable and isolated people and innovating their own services. Organizations were most effective in reaching vulnerable, isolated, and disadvantaged populations at risk of mental health issues when they worked in close collaboration with social and mental health care providers. While some people are keen to return to in-person events, the sense of risk is strong for others. Online provision remains vital for those with health conditions or vulnerable family members. Arts and culture organizations are exploring creative means of integrating online and in-person provisions. Those who engaged in arts and culture frequently during lockdown had significantly higher well-being scores than those who engaged in arts and culture never or rarely. While audiences appreciate the option of alternative provision, barriers to online inclusion such as cost, accessibility, are exacerbating a growing digital divide. Arts and culture organizations need expert support on platforms and products, safeguarding procedures, effective staff training. These findings highlight that the arts and culture sector can play a major role in improving mental health outcomes across the city region if properly integrated into public health strategy. They emphasize the need to support sustainable partnerships between health and arts providers, coordinate local initiatives, maintain alternative hybrid provision of arts and cultural activity, and train all stakeholders in digital know-how. We are now working on a new digital resource showcasing innovation and best practice in inclusive arts in mental health. Liverpool Art of Care, or LIFCare, will inform policy, widen provision, and foster cross-sectoral cooperation and decision-making by service providers and service users.